Hello everybody. Nowadays, coronavirus disease spreads around the world.
Unfortunately, more and more people get sick. There is currently no vaccine to prevent COVID-19.
So, what can we do to protect ourselves and protect others?
The best way to prevent illness is to avoid being exposed to this virus.
The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes during the close contact or the things which infected person touched or used.
These droplets with virus can land or can be transferred in the mouths or noses of people who are in close contact with infected person or infected things and possibly can be inhaled into the lungs.
It is very important to take steps to protect yourself.
Clean your hands as often as it ever possible.
Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing.
Use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry.
Please, avoid touching your eyes, nose, and mouth with unwashed hands.
Remember that older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness.
That is why it is very important to protect others, especially older ones.
Try to stay home if you're sick, except to get medical care.
If you are sick, you should wear a face mask when you are around other people, for example, when sharing a room or vehicle. Put on a face mask before you enter a healthcare provider's office. If you are not able to wear a face mask, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter your room.
Do not forget to cover coughs and sneezes. You can use a tissue or use the inside of your elbow. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol.
Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them using detergent or soap and water prior to disinfection. Most common EPA-registered household disinfectants will work. Use disinfectants appropriate for the surface.
Remember, you are also responsible for your health and the people around you.
Stay healthy.